Now prepare to be inspired by our opening keynote on transforming healthcare through disruptive digital innovation. I'm repeating innovation but not innovation. Our speaker is none other than Dr. Raghunath Mashelkar, President of the Global Research Alliance and recipient of Padma Vibhushan, Padma Bhushan and Padma Shri Award. He embodies the spirit of innovation, reminding us that the best way to predict the future is to create it. Let's welcome Mr. Raghunath on the stage.
Thank you very much, Vishnu. To use your words, I'm super duper excited and particularly very, very inspired after hearing you. Thank you very much for having me. I think it's a great honor and a great privilege. Let me begin by explaining the title of my talk. The title is Transforming Healthcare Through Disruptive Digital Innovation. I don't use the word innovation, but innovation. Digital, yes, that is obvious. I think Vishnu made a great case. Digitalization, decentralization, decarbonization, that's what driving the world today. So there is no issue on that at all. Secondly, I want to reflect. Vishnu, do you know my age? I'm 82. Okay? So I've seen a lot. And there was a saying in India that when in doubt, when in difficulty, form a Mashelkar committee. So I have laid some 16 Mashelkar committees, starting with Bhopal disaster to education, environment, and whole range of things. And one of them was in 2003. This was about the regulatory structure systems that we had and how do we reform them in health. I was chairman of that, 2003. The word digital did not appear in that report. Word digital dominates everything now, but in that report. 2 years later, WHO Commission on Intellectual Property Rights, Innovation and Public Health, Madame Ruth Dreyfus, the former president of Switzerland, was the chairperson. I was the vice chair. The word digital hardly appeared there in 2005, 2 decades ago. And today we talk about that particular sort of dominance and how that word is going to change. So I think that actually, for an old man, that's something that actually stands out, the way things have changed dramatically and disruptively. The other point is about the word innovation. That is Indian innovation, but also innovation for India and innovation done by Indians. There is something special about Indian genes, by the way. We do 10x better at 10 times lower costs. All right, not 10%. Like, for example, Mangalyaan Mars orbiter mission, it was 10 times cheaper than what US did, but we succeeded in being successful for the first time. There is something special. Affordable excellence, as we call it, because normally affordability and excellence don't go together. In India's case, it does by necessity. Okay, that's number one. And also for India, that is the important part, Indian innovation done for India. Now, if you see, there is a interesting challenge about Bharat and India. We celebrate India at 75, but what about Bharat at 75? That's an interesting challenge. Can you see this figure? You can see India at 75 staying in the multi-storied buildings, and Bharat at 75, just next door, staying in slums. So any solution that you talk about, they can't be just exclusively for India at 75, because you can see the inequalities are exponentially rising. And therefore, the first point I want to make is that even for DHN, it's extremely important to consider Bharat at 75, all right? And we have to be inclusive from that sense. Now, if you see, the building disruptive digital innovations in healthcare, to my mind, there are 7 tenets. The very first one is affordability and accessibility. Otherwise, you will leave out Bharat at 75. Don't forget 70% of India remains in villages. 1 out of 6 in urban areas stays in slums. 1 out of 5 is still illiterate. All right? These are stark realities. You have to accept them. You can't hide them. All right? So we have to have affordability, accessibility, and scalability. And this entire set of sessions that you have are on scalability. How do you make an impact? If you don't scale, you won't. Then sustainability, of course, is obvious. And of course, when it comes to digital, the data privacy and security becomes important. Interoperability, extraordinarily important in this particular case. Confidentiality and trust. I think the major issue is going to be also the trust. How do you ensure that this new digital world is trusted by everyone? So I would suggest that we look at these 5. You already have these on your agenda. I am aware of that. Now I want to move to something else, which is, if Bharat at 75 is so much behind and there are so many inequalities, 2 meals a day is a challenge for some people, then how do we get digital access? That's the first important point. And that is where I proudly mention about the geofication that created the magic of digital access equality despite income inequalities. Like affordable excellence, this also looks very odd. How can you create access equality despite income inequality? I have been on the board of Reliance for 17 years and have been chairing their Reliance Innovation Council, which has people like John Mary Lane, the Nobel laureate, Bob Grubbs from Caltech, Nobel laureate, he is no more now, C.K. Prahlad, for example, and so on. And Mukesh and I used to have conversations. And as you can see here, they believed in growth as life. And then after the Innovation Council, we said innovation, we must make it as a way of life. And then, of course, innovation-led growth. But Reliance doesn't believe in incremental growth. They believe in exponential growth. And they have undergone that exponential growth, as you know. And you can't get exponential growth by incremental innovation. You have to do disruptive, game-changing innovation. So once we are talking and he said, Doc, we must leapfrog to something. I don't remember what it was. And I said, do you know, Mukesh, why did the frog leap? He said, I don't know. I said, frog leaps because he's afraid of the predator. He is afraid of the enemy and he jumps a few feet. Should we be doing that? Or should we pole vault? The size of the pole is the size of the aspiration. And that actually led to one thing or the other. We created a program called Beyonders in Leadership and so on. And then that finally India pole vaulted, as you know, from 155th position to number 1 position in mobile data. They did not leapfrog to 100, but pole vaulted to number 1. This is where we were. And after Jio's entry, you can see the way we jumped. We actually have captured this in this particular book, Leapfrogging to Pole Vaulting, that we wrote, which also got the Best Business Book of the Year award later in 2019. And you can see the difference now, that access equality and income inequality. Digital access equality is 1:1, although the income inequality between the two. And Jio made it possible, 4 rupees per GB and voice free. And 500 million customers, 1/3 of India, all right? So when we talk about the digital public infrastructure and the difference we made, it is this. And then I was in San Francisco and giving this GMG Excellence opening keynote address just last July. And I remember very proudly showing this Jio Bharat, $12, empowering 250 million 2G mobile subscribers who cannot afford a smartphone, giving them an internet access, all right? That is true inclusion, so as to say. That is the digital access. Then we can start about digital transformation in terms of healthcare. Unless this happened, it would not have been possible. What I'm going to do is that I'm not going to talk about big houses. Vishnu, you talked about looking at startups, looking at your challenges, and so on and so forth. I'm going to go to that community, basically, all right, because they are going to be the real players. So I want to take you through the story of Anjani Mashelkar Inclusive Innovation Award. Anjani Mashelkar is my mother. She passed away. Many of you may not know that I was born in a very poor family. My father died when I was 6. I was in a village and my mother brought me to Mumbai, this city. I walked barefoot until I was 12. I studied under street lights. It was a Tata scholarship of 60 rupees per month, because of which I am standing here, because of which I could basically study. And I remember my mother left whatever she had when she passed away, and when my daughter Shruti was organizing her saris, she found some money that I used to give her every weekend when I came from Delhi while I was the DG of CSIR, stuck there, and saying, use this money to help those who do science for the poor. Don't forget our origin. And I created this Anjani Mashelkar Foundation. And this foundation actually gives access equality to income inequality. And this has been running for 13 years. I think you should, I'll send you the details of this, Vishnu, in terms of what they have been able to do. Now, all these awardees, there is something common between them. There are 3 things that are common between them. First, Vishnu, I'm not very fond of best practice, because you are copying somebody's best practice. I believe in next practice, which should become the best practice for others. The second point is making high technology work for the rich very easy. Making low technology work for the poor, very easy. Making high technology work for the poor, very difficult. This is common between them. And the third one is that they are not the ones who are chasing to be a billionaire. They want to bring the smile on the faces of a billion people, so as to say. Now, I can't go through all of these, but just pertinent to the topic today, I would talk about innovation done by all these young Indians which are chasing exponential affordability. What is exponential? Not 10%, 10x, 100x, and so on. Now, just 2-3 examples. If you look at the last year's award, Anjani Mashelkar Prize 2023, which Gayatri got for Intelligent Health Risk Assessment, IHRA, what is she doing? She is actually providing tests for metabolic conditions. The best practice is, of course, the standard invasive one that you see. I don't have to explain that to you. She has created a next practice where you can see, for example, that she is able to do it in a painless way, in real time, AI-driven. And this is an AI software that uses thermal camera and predicts risk scores for diabetes, hypertension, and dyslipidemia, just for 5 rupees per test, so as to say. This is going places now. You look at this awardee, Shwasa. This is a AI-driven platform technology that assesses respiratory health through audiometric analysis of cough sounds, by the way. It has been trained. And what is the difference, basically? The standard one, the best practice is spirometer. The next practice is just you take your smartphone and cough into it. And you can see the equipment cost for a spirometer is 1.5 lakh. It is 0 because you already have the equipment with you, the smartphone or phone. The assessment cost is not 1500, just 1 rupee. And the results 90 minutes versus instant. And 3 lakh lung health scale assessments have been done so far. And the scientific validation, this is very important, by the way. Vishnu, when we talk about startups in India, and of course we are very proud of what we achieved, but if you really look at the deep tech startups, that percentage is less than 5%. That's not on. I believe in high science-led, high technology-led startups. which are disruptive. And therefore, in each of these awardees, we are asking them, where is the deep science? Where is the deep technology? And you can see here, for example, this development and clinical validation has appeared in Nature, which is the highest scientific journal. And the core technology, which is based on audiometric analysis of cough sounds, this is a patented machine learning algorithm, Shwasa. And it's not just diagnosis, the risk for different, this one, but also COPD, TB, asthma, COVID, pneumonia, etc. India needs diagnostics which are non-invasive, affordable, user-friendly, and yet high technology. And non-invasive, you have to go to the extremes. Just coughing is completely non-invasive, okay? You look at the next one. For example, in 2020, we gave this award to Senthil Murugasen and Dinesh Pandian. And if you just see this remote pregnancy monitoring and risk prediction, because as you know, rural women, for example, when they get pregnant, they have to travel by buses to go for medical checkup and so on, so forth, etc. Senthil said, why should my sister be traveling by buses? Why can't I create IoT sensor-based systems? For example, he has created that. And this AI platform that he has created tracks 35 parameters in pregnant women and predicts the risk of pregnancy in the first trimester itself as against the third trimester. And you can see the kind of difference that I'm basically talking about. And he has onboarded 3.6 million women on the platform, assisted 35,000 successful deliveries, and partnering with state governments now. Very important to partner with state governments. You talked about regional ecosystem and so on. For example, Andhra Pradesh has made it mandatory. So I'm talking about innovations, I want to insist, which are scaled. They are not just demonstrations of some toys. Look at Save Mom. It has already appeared as a Harvard Business School case study. And not only that, this is one of the finest applied artificial intelligence institute in the world, Deakin University. They came and said, we want to join in. Once again, the point is science, technology, innovation at the cutting edge, basically, all right? Not jugaad. India is very proud of jugaad. I hate jugaad. That's not what we should be doing, as a matter of fact. This is the India of my dream. Then look at this Modit Dundavate, for example. Any bed into step-down ICU rapidly. This is a continuous contact-free vitals monitor, 10 times cheaper than the products used in ICU, no maintenance, etc. FDA certified, is going all around the world now. And it is saving lives. For example, just have a look at this. You can see here the way the monitoring was done, and suddenly at 2 a.m. there was a sudden surge. No nurse would have been able to detect it, okay? And that life was sort of saved. And this has made a big impact in terms of, you can see this in India, but it's going around the world now. And you can see the comparison between the standard and what this is able to do. In less than 15 minutes, you can take kind of a stand-up ICU, 7 parameters being measured, and 144 lives in a year for 100 bed, you can see making that sort of difference. And the last one is this 2021 award, which is for oral scan. This optical imaging multimodal device for identifying precancerous lesions of the oral cavity. And this device captures multimodal images of tissue fluorescence, and these are then objectively discriminated through cloud-based AI ML algorithms. I just want to, this is a bit of an advertisement, just as you talked about. The new awards, by the way, the award is just 1 lakh, it's a small amount of money. But as you can see, we do a lot. Not only the awardees win the award, but we secure funding for them. You know, our challenge is venture capital has become vulture capital. We require adventure capital. I'm sorry. All right. We require that early stage financing, and nobody wants to bet on this. They want returns. All right. And these are something that is doing public good. So we have created, there is a source, I can't disclose what it is, but 30 crore have been set aside by a person with a big heart for supporting something like this, because you can see it can make a difference. And we, of course, do several other things in terms of creating market access, accelerating the whole process and so on. So it is not just award, clap, photographs and over. We hold hands and sort of take them through. Indian government, of course, and so this is the story of our young people, as I said, who are making that big difference, creating the next practice, not the best practice, not just remaining local but going global and making a difference to the whole world. Uh, Government, of course, I'm very proud to say there are a number of initiatives that have been taken. Ayushman Bharat Digital Mission, e-Sanjeevani Telemedicine Service, National Digital Health Blueprint, Integrated Health Information Platform, National Health Stack, Arogya Setu Setup, CoWIN Platform, National Digital Health Mission, and so on and so forth. So there's a big movement on digital healthcare. And this is something that I love. The title of my talk, by the way, in San Francisco was India's emergence as an exponential inspirator. You can see an exponential here, and you made a mention about that, you know, how the street vendor on a QR code can make a difference, etc. I love this sorts of exponential. I love exponentials because what it is showing, you can see in 2021, UPI clocked almost 46% of world's transactions. The most unbanked country in the world within such a small time went exponential. This is what India actually needs. And you mentioned about the UPI movement in Indian health tech, but this is what we now need to do now, creating that unified, united health interface, and how we can create apps by which we can sort of move forward. In the same way as we did in the financial, can we do it in the health? That should be the dream. I think if you look at CoWIN's story, the EVIN was repurposed for CoWIN, and this became a cloud-based platform for planning, implementing, and monitoring COVID-19 vaccination, offered real-time data on vaccination programs, minimizing vaccine hostage. And you can see the paper-based vaccination record certificate that were implemented in US. And this is our pole vault, India's digital platform COVID-19 on CoWIN, by the way. I showed this very proudly. I think it deserves a clap, does it not? Come on. All right. Okay. No, I think why I'm mentioning this is that, come on, the time has come where we start leading and not following. That is the point I'm trying to make. India's national health stack, this is a big story. Now, I don't want to explain that because all of you actually know. I think that gives us a big hope. The national health ecosystem now is supporting universal health coverage and wide range of data, information infrastructure services, duly leveraging open, interoperable, standards-based digital systems, and ensuring the security, confidentiality and privacy of health-related personal information. This is actually the dream. That's what we have to basically achieve. The key challenges, as you very rightly mentioned, is finally not just going to Chennai and Kolkata and Mumbai, but also looking at the rural villages where 70% of Bharat lives. And what are the challenges? The lack of healthcare access, driving high mortality. ASHA workers, they are overburdened, underskilled, and poorly incentivized. All right? Can we partner with them and can we digitally integrate them? That is the big challenge. And there have been also lack of innovative financing models. I do hope that during the day you will have some conversations on this. This is very important. And this is DISHA, Digital Innovations and Interventions for Sustainable Health Tech Action. Our foundation is trying to partner with them. And the way the challenge is, and I have just 2 more slides left, is, for example, if you look at screening of women, you have this big challenge of screening, testing, treating, and retesting. And if you look at hemoglobin tested, it's only in 20% of women. Anemia affecting 57% of women. And lack of hemoglobin test kits in community. This is the challenge. Okay? So here are ASHA workers, and here is the challenge. How do you solve it? Now, here is the solution. This Anjani Mashelkar Awardee, Mishkin Ingawale, created what is called as a Touch HB. What did he do? He had this device which used photoplethysmography, spectrophotometry, advanced software, photon scattering. You just put your finger and you know what your hemoglobin is, just for 5 rupees, okay? This became the best practice because non-invasive and the rest of it. He replaced that with the next practice, okay? And what was the next practice? Here is a camera. It captures the picture of conjunctiva and uses the method of reflectance photometry to estimate hemoglobin content in the blood. Now, can you just see, what are you talking about when we say non-invasive? You cough into a phone and you know what's happening. You look into a camera and look at what's happening. That is the level of technology that we need to actually develop. Best practice to next practice. There is a paper that I have written on reinventing healthcare. I'll send you a link, actually, in particularly from rural settings, using whatever we have. This is a cover page story in civil society that will give an idea about some of these thoughts that I have expressed. And I would simply add the following, that we need to move. We have been a country which has been following. Then we prided ourselves in being, we are fast followers. Any new drug molecule that is discovered, within 18 months we'll copy it. Okay? Nothing wrong in copying because our patent laws allowed it. And we became the pharmacy of the world, right? High quality generics. But I think we have to now lead. That's very important. And not just lead, and not just leapfrog, but pole vault. And I've explained to you what pole vault means by giving these examples. We are capable of doing that. This is my final slide. This is General Bipin Rawat, who was Chief of Defense Staff. As you know, he's no more. He had read the book, Leapfrogging to Pole Vaulting. And the following day he was interviewed and he said, time has come to move from leapfrogging to pole vaulting. For India, the time has come. Thank you very much. I have to apologize because my problem is I wear too many hats. And one of them is a chairman of the jury for some national awards, which are being given by the governor exactly 1.5 hours from now in South Bombay. So I will have to leave my deepest apologies. In fact, I wanted to sit here and learn. So please forgive me for that. Thank you. Thank you for having me.
I'll close my closing remarks just after that because Mr. Mashelkar is in a bit hurry. So let's take a moment to appreciate Mr. Mashelkar for his wonderful presentation. I would like to invite Mr. Vishnu Saxena and Dr. Girish Kulkarni to present on the stage and present the award to Mr. Mashelkar to be here, that we could seize this opportunity to actually hear from him his golden words. Please welcome.
Mic, mic, mic.
Huge round of applause, guys, for Mr. Mashelkar.
I wanna say a few words to Mr. Mashelkar. So I was in a car. Our colleague Aarti informed me that Mr. Mashelkar is coming at our forum, and she talked about the topic is, innovation. I said once again, Aarti, it's innovation. So she said, no, it's innovation. I said, Mr. Marsh, then I stopped for a second and I thought about it, innovation. And I immediately connected the dots. It's indigenous innovation, India-led innovation, made for India, And I was very impressed with that word, with innovation. I had never heard about it. And I was very much looking forward to have you, Mr. Mashelkar, and thank you so much. You're very young. We look forward to more wisdom from you.
Thank you.
Sir, just be here for a moment, please.
Mr. Mashelkar, please. Thank you.
Thank you so much.